Hello, my name is Kara Lewis. I'm an associate investigator at Kaiser Permanente Washington Health Research Institute and president of the Society for Implementation Research Collaboration, and I'm going to be talking about implementation science measurement. And I'll start by giving an overview of the state of the field in terms of measurement, and then honing in on the measurement of implementation outcomes, talking with you about key measurement issues that have emerged in recent years, and then sharing with you resources that might help with your work going forward. So like many new fields, implementation science is vulnerable to measurement issues. There are two interrelated problems that influence these measurement issues, and that one is inconsistent terminology. For instance, albeit this was a publication from about a decade ago, Graham and colleagues discovered that 29 distinct terms were used to refer to some aspect of D&I across 33 applied funding agencies in 9 countries. And unfortunately, this kind of inconsistent terminology undermines the capacity to identify and share measures if constructs are indeed synonyms. And conversely, if they're not synonyms, but they're treated as such, then we have a diffuse knowledge base and unnecessarily redundant measurement tools, which is very problematic. The other issue that we see is that in 2012, there were over 60 existing models, theories, and frameworks with redundant constructs, unique constructs, synonyms, and it's become unclear which constructs matter most and should be measured and at what time point. And many of these theories, although they would, if most useful, they would articulate relations between constructs, that which we see in existence are not so theoretical in nature, so we don't quite understand the interrelations yet. And this makes it tricky from a measurement perspective to know, again, which constructs to measure when and how. And why does measurement matter so much? Well, essentially, science is measurement. Any research question you seek to answer or aim you wish to test needs to be evaluated. And the most common form of measurement that we see in implementation science comes in the form of self-report measures. These are particularly vulnerable to issues of reliability and validity, and it makes us question, is measurement scientific in terms of the development process that it's moved through in order to establish psychometric properties that would lead us to be confident in the results that we obtain. So fortunately for us, we can look to a variety of systematic reviews on implementation science measurement in recent years. So at least 7 exist. Importantly, they do hone in on single constructs. 3 of them did. One used the Durlac and Dupré model, which has 5 key organization levels that they considered in their review of measures. And then another 2 reviews focused on constructs that that were situated in a prominent D&I model. And what we learned from these systematic reviews, 2 studies looked at content validity, and it appears that nearly half of the studies that produced measures didn't even ensure that the items represented the facets of the construct that they were intended to assess. So this is pretty appalling, actually, to think that if you were to select a measure of, let's say, acceptability and implementation outcome, you might not be able to be confident that you're actually assessing all facets of acceptability for about half of the measures that are available to you. Most commonly in these systematic reviews, the authors were simply reporting yes or no. The authors had some evidence of reliability or validity. And this is tricky when you have such a global assessment of psychometric strength because, you know, we realize that you have to establish reliability in order to have validity, and these systematic reviews aren't disentangling those properties in a way that's most helpful. So CIRC did pursue an effort to try to expand on these existing systematic reviews, conduct an enhanced version, really to be a resource for the field. And we wanted to have a broad reach of the repository that would emerge from this work. And so we first set out to identify a theory or framework that would house the most comprehensive listing of constructs. So I wish to say that what you see here, the CFR, the Consolidated Framework for Implementation Research, it is not necessarily that I'm suggesting you use this in your implementation project as an evaluation framework. Rather, we selected it when building a repository because we thought that it would allow us to hit on the most comprehensive listing of constructs so that regardless of the theory framework model that someone used in their implementation evaluation, they might be able to go to our repository and find a measure that would be useful to them. And so if you're less familiar with the CFR, I'll just say a couple of things. It was derived from a synthesis of 19 existing D&I frameworks at the time it was published, 2009, and it attempted to harmonize disparate terms, provide consistent construct definitions, and summarize evidence for each construct. And so this made us feel, when we started on this effort in 2011, it made us feel confident that the CFR would indeed be a really useful framework to outline the constructs for which we would identify measures and evaluate their psychometric strength. So 37 constructs emerged from the CFR. And then importantly, as you all know, implementation science has its own set of outcomes. Now, this is a framework that Enola Proctor and colleagues put forth in 2009 at first, and then a revised version in 2011. And you can see here that there was a very intentional separation of implementation outcomes from service and patient outcomes. It's not that we as implementation scientists don't care about service and patient outcomes, but rather we have a more more proximal focus on the implementation outcomes of acceptability, adoption, appropriateness, cost, feasibility, fidelity, penetration, and sustainability. And importantly, we must make sure that we have the most appropriate measures for each of these outcomes if we are going to have confidence in our evaluation of impact. And so together, when you combine the implementation outcomes that you see on the top upper right-hand corner of your screen and the CFR domains of characteristics of individuals, inner setting, intervention characteristics, outer setting, and process, we see 47 constructs here. And this was our attempt to have a relatively comprehensive map of constructs that we then dove into for a systematic review of measures. We were guided by measurement theory, where we aimed to describe, categorize, and evaluate the quality of measures, improve the usefulness, accuracy, and meaningfulness of measurement, and propose methods for developing new, higher quality measures. We had a suspicion that, that there was a need for helping to guide researchers through the measure development process, and maybe well, especially, I guess I would say, in the case of implementation science, we often have to rely on very rapid methods to be responsive to our community partners' needs, and so we thought maybe we would be able to devise a more rapid yet rigorous measurement development process. And we relied upon classical test theory, wherein reliability and validity were the fundamental attributes of measures necessary for confidence in meeting of findings. So what you see here is just one version. It's our version of an evidence-based assessment criteria, and essentially we identified these psychometric properties of importance that we would then evaluate each measure we identified on. So reliability, validity, sensitivity, practicality, each had score options from 0 to 4 with a total possible score of 24. And so what we did was we engaged in a systematic literature review that was construct specific at first. So yes, you figured it out. We've embarked on 47 individual systematic reviews. And once we identify an instrument or a measure, we then conduct a specific review of that measure, trying to identify all published information about it. We pull these packets together, extract the information that's relevant to the evidence-based assessment criteria. Each measure or instrument's rated twice using the criteria, and we're doing this for 450 plus measures, actually. And what I thought would be useful today is to talk about some of the findings from this systematic review, because as you embark on your implementation evaluation, you probably want to know what constructs are there good measures for and which ones need measure development. And at the time that this was published in 2015, albeit the search stopped in 2013, I think, we couldn't find measures of complexity of the intervention, design quality and packaging, attention for change, engaging champions, for example. And so this is tricky. These are known constructs of importance to implementation, and yet we don't have measures to evaluate them. And at the same time, we've got several constructs for which there are over 20 instruments or measures, which presents just a different state of confusion, I think, to researchers. You know, among the, I think it's 40-odd acceptability measures, how and which one would you choose? What we then did was map the development of measures over time, and we did this because we were curious to see if there's been a proliferation of measure development on key domains of interest. And interestingly, indeed there has been. This might be a little hard to see on your screen, but the red bar reflects implementation outcomes. It's the tallest bar in this red circle. And you can see that after the Proctor et al. Publication in 2009, there's an uptick in development of instruments for implementation outcomes. So this is great to see that when a need is identified, research and follows. And hopefully we'll see that the quality of these measures is growing as well. Unfortunately, this next slide suggests maybe not so much. So what I'd like to share is that there is some consensus around what gold standard measure development steps would look like. And they include defining the construct, generating initial items among a group, pilot testing items with a representative sample, establishing initial validity and reliability with pilot testing, refining the instrument based on pilot results, and then administering it to your target sample, reassessing validity and reliability, and then reporting out on the initial evidence of psychometric properties. These are 8 steps that are recommended to generate a strong measure and to be followed in this order. And in our review of these 450 measures, we saw that the average number of these steps that a measure developer went through was 3 of the possible 8. The mode was 1. And when there was 3, it wasn't even that they went through the first 3. They just got credit if they went through any 3. And so this is concerning to us that the majority of the measures in use are not likely to be properly developed or validated. And one other example that amplifies our concern is just this idea that, well, this observation that we made that only 3/4 define their construct. And so if you're not defining your construct, it's not clear that what you're measuring is measuring that which you intend it to, and it's difficult to communicate that out to folks interested in using the measure. So one thing I just want you to be thinking about as you go forward in this work and are looking for measures yourself is that databases are actually often not the best place to identify measures. In our search, our most fruitful approach was to actually go through Google searches and listservs and announcements and basically networking. And fortunately, we have done some of that for you, as have several other measure repositories that I'll point you toward in a moment. The way that articles are tagged and mesh terms are used makes it so databases aren't the best spot or the easiest spot to identify measures. So just a little tip there. What you see now is a deeper dive into the state of implementation outcome measurement. And so if you recall from the evidence-based assessment criteria presented moments ago, we had a range of possible scores on each individual criterion from 0 to 4, 4 being excellent. And the mode score here for all the 104 measures of implementation outcomes was 0, no evidence at all for psychometric strength. And I put in red boxes, some of those zeros where these are psychometric properties of really great interest, and yet there's nothing. So predictive validity and responsiveness, for example, are very poorly scored for the measures in existence. And perhaps unsurprisingly, what we see is that the more articles there are that have used a particular measure of an implementation outcome, the higher its psychometric strength. So on the x-axis here, you have the evidence-based assessment criteria score, the total score, 0 to 24, and then the number of articles on the y-axis. So it's unclear to us, though, if this is reflective of good measures getting used more, or the fact that people are taking up a measure and using it, they're contributing to the evidence of a psychometric strength of a measure. And that's an important point that I want to underscore, which is that just because a measure might not have psychometric strength established doesn't mean it doesn't have promise. And so one of the jobs of us as implementation scientists is to contribute to the development of psychometrics. And so it might not be the case that an individual in one study can go through all 8 measure development steps, but maybe you could contribute to, for example, predictive validity testing if you had a longitudinal study design and were powered to do so, whereas someone else might not have. One of the biggest issues that I'll mention probably a couple times is that we see a preponderance of homegrown one-use measures, and this isn't serving anyone. It's a ton of work to develop measures, and when they then go and immediately sit on the shelf and don't get picked up for second use, it's an opportunity cost and resources lost. But then in terms of our repository, if you were to look to it as a resource to identify measures, this is the kind of thing that you'll see for a summary of the psychometric property evaluation. Excuse me. So this is just an example of measures of adoption. So you see the measure names listed there. Each bar is reflective of a single measure, and you see the colored segments of the bars reflect the different psychometric properties or evidence-based assessment criterion. And so, you might look to this set of measures of adoption and decide, well, I'm going to hone in on those that have the longest bar because that suggests that they have the most established evidence of psychometric property overall. Or you might say, I really need something that has norms associated with it. I want to be able to tell my partners that how they're scoring compared to a national or international comparison group. And so you then just hone in on the green bars, and those that don't have long green bars within them, you might choose to ignore those measures because you've decided norms is important. So that's just a quick snapshot of the kind of data that you'd have access to in the repository. And here are some of the issues that we've seen then emerge through our systematic review work and the work of others, some of which I've already stated. Pretty commonly we see that folks aren't accessing a theory or framework when they're developing a measure, and so this means that their construct definition, if they even generate one, might be devoid of theoretical facets that would be important to its construct validity. We also see homonymy, synonymy, and instability of measurement where, excuse me, we see measures that have different items, but people are saying it's measuring the same construct, or we see measures that have the same or similar items, but people are saying they measure different constructs, and then we see measures that have the exact same name, have items that change over time. And each of these three issues is incredibly problematic from a systematic review standpoint, but also a cumulative knowledge standpoint. And so a lot of what is happening with this one-time use phenomenon and changes in measures at this level is it becomes really, really difficult to compare findings across studies. I've said this probably the most, that there's very little psychometric testing, reporting, and strength available. This is another one that I've mentioned several times. We also see, and I'll come back to this on a different slide, an over-reliance on self-report. And so I didn't say this when I first mentioned self-report being most common, so I'll say it now. Self-report is appropriate if you're looking to assess the beliefs, perspectives, attitudes, and knowledge of an individual. And so that clearly has relevance and is appropriate in the case of, for example, wanting to understand the attitude of a provider toward an evidence-based program. However, if you wanted to see how much the program has been taken up and penetrated an organization, self-report will only give you an individual's perception of uptake or penetration. And so you can see from that example that self-report is not necessarily appropriate for all of our constructs and outcomes of interest. And I'll circle back to that in a moment. There's also been a lack of attention to pragmatic relevance. This is something I'll dive deeper into, but essentially, for one example, we have some measures of implementation constructs that have 31 subscales and hundreds of items, and this is just taxing on our community partners. We also see redundant development of measures across teams, which is not inherently bad, but if there is a high-quality measure available that does have pragmatic and strength as well, then resources might be better used in further establishing evidence of its psychometric strength as opposed to developing a new measure altogether. So this slide, I hope, will be a resource to you that you can go back to after the lecture. This is focusing just on dissemination implementation outcomes in the top left. And what we've done is pulled together some just useful information about each outcome, the level of analysis that is most typically of focus, the theoretical basis for the outcome, other terms you might see in the literature that refer to the same outcome. And then I've done some careful thinking about how, at what stage in implementation each outcome is most salient, because if you think about exploration, preparation, implementation, sustainment, as Greg Ahrens and colleagues view implementation to go, you might not necessarily have the resources, or it might not be appropriate for your community partners to assess all 8 implementation outcomes at every stage. And so we're trying to provide some guidance around that. And then, as I mentioned just on the last slide, not all of these outcomes are best conceptualized as a latent variable. Some would be able to be directly observable, and so it's important to note which those are. And then I've also got a column for an example method of measurement. And so I'll just reveal this. I'm not going to go line by line because I think it's overwhelming and unnecessary, but like I said, I hope is a resource to you that for each of the outcomes listed here, you can have some guidance around what is the level of analysis I might consider, what is the theoretical basis here, how else are people thinking about it in terms of the synonyms, and then what phase of implementation might I be best measuring these outcomes? Is this best conceptualized as a latent variable? And then what are some methods of measurement from survey to administrative data and so on? Okay, and so the heading is wrong here. I apologize for that. What I wanted to highlight is a parallel resource that you might wish to access, and this is the Grid-Enabled Measures Project. There's a paper published on their methodology in 2012, and this is a pretty neat crowdsourced way of building a repository. And so, you might access it if you're looking for measures, or it's a way that you yourself as an expert could contribute to making sense of or informing the psychometric property, because you yourself can contribute ratings essentially. So the website is there for you. So given all of this work and our sense of the field now as having several measurement issues, our team pursued and was awarded an R01 from the National Institutes of Mental Health to pursue 3 aims, one of which was to establish a stakeholder-driven operationalization of pragmatic measures and develop reliable, valid rating criteria for assessing this measurement construct. And I'll spend a little bit of time telling you what I mean by that. And then another aim was to identify CFIR and IOF linked to the Implementation Outcomes Framework linked measures that are both psychometrically strong and pragmatic. And so why we care about this is that measures are typically a scientific phenomenon that allow us to answer research questions, and yet we believe that measures might also be pragmatic, meaning that they could be used by people on the ground seeking to do an practical implementation outside of a research context, and that a measure could help inform their process. So if we had a reliable, valid, pragmatic measure, let's say of organizational readiness, and we know that that could be a huge determinant of practice for implementation, an agency leader could potentially independently assess their organizational readiness. If they determine it to be problematic, they might choose not to bring an external facilitator or trainer in to train up on a new EBP, but rather they might choose to do an organization-level intervention to up the readiness before they invest resources in a training. So that's my vision for how measures might be able to serve the field in terms of having a dual emphasis on science and practice. And so we really needed to know, what does pragmatic mean to the stakeholder? And so let me walk you through of what it might mean, this pragmatic measures construct. So here you see the CFIR again. Recent research is really pointing toward intersetting as having a critical influence on the success of an implementation. And so here's some evidence of this from a measure put forth by Glisson and colleagues. It's the Organizational Social Context Measure. It assesses culture, climate, work attitudes. These are all constructs within that intersetting domain of the CFIR. Their measure is really cool in that you can reveal profiles for an agency compared to these national norms, and it predicts implementation, clinical outcomes. It can guide your implementation intervention selection and improve implementation success and child outcomes. So this is, to me, an example of a measure that has really excellent psychometric strength and has great potential to inform practical side of things. Yet simultaneously, the measure itself costs $4,000 to use. It has 105 items and requires expert scoring. Those are properties of the measure that might make it less pragmatic. So we interviewed a purposefully sampled set of stakeholders and asked them what pragmatic measures meant to them. So that was one of our starting places. The other starting place for articulating the pragmatic measures construct was a systematic review of what previous researchers had identified, but we cared deeply about the stakeholder perspective because it's in the eye of the beholder, I think. We vetted all of the terms and characteristics of pragmatic measures through a host of stakeholders in a concept mapping exercise to reveal conceptually distinct domains. And then we engaged stakeholders in a Delphi process to reveal priorities of the pragmatic measured construct based on their perspective. And we're running it through a test-retest reliability to reveal, similar to that evidence-based assessment criterion you saw before, we'll have a pragmatic measures rating criteria that we can apply. And so here is what emerged from our process so far. We have a stakeholder-facing rating criteria that includes acceptable, offers relative advantage over existing methods, it's completed with ease, it's appropriate, it fits organizational activities, and informs clinical or organizational decision-making. And so we think that those facets of a pragmatic measure have to be defined by the stakeholder themselves, whereas there are some things that can be objectively rated from the literature. So the cost, accessible language, assessor burden, and the length. So that's all I'll say about the pragmatic rating criteria. I just would encourage you to think about how this interacts with the evaluation efforts that you do, the collaborations that you have with partners, to see how measurement might be more than an evaluation tool for the researcher. The last piece of this work that we're doing is developing 3 new measures of implementation outcomes, and I thought that this would be important to share with you, because if you were to want to measure acceptability, feasibility, appropriateness, we have developed new measures that you might wish to access. We selected these 3 implementation outcomes because they're predictors of adoption, and they're most salient, if you look back to that large complex table I showed you, they're most salient early on in an implementation. And so we went through a very careful domain delineation process, and I'll let you access those definitions on your own time. But then we developed these measures and established evidence for each of these properties, so substantive validity, discriminant content validity, scale reliability, structural validity, known groups validity, test-for-test reliability, responsiveness to change, and we're currently testing predictive validity, discriminant validity, and structural invariance. And we do think that these measures have pragmatic values, pragmatic strength as well, and here are the measures, so that if you wanted to use them in your work, in the brackets for intervention, you put the name of the intervention you're looking to implement, and you'll be able to retain the psychometric strength. As you can see, there's 4 items per scale. They're not meant to be used as a suite of measures, but rather if you were just interested in measuring acceptability, you could. So from this work, we think that we'll find clarity on a measurement-focused research agenda, and we'll offer out a repository of measures that have information about their psychometric and pragmatic quality. And we're going to engage a group of experts to help us identify a core set of instruments or measures that could be used across studies. So that's something that will come out in the next year or so, where experts will have received the psychometric and pragmatic ratings from this work, and then given a subjective determination of all the measures for each of those 47 constructs, which measure would they, quote unquote, endorse, and hopefully we'll see commonalities across this group of experts, but that's yet to be determined. So more resources for you. This is a paper that several of us pulled together after an NIH working meeting, and we went through measurement resources like the CIRC repository, like GEM, and we tried to identify anything else that offered helpful measurement information, and we characterized these, we coded these, if you will, in a publication. So we identified 17 measures resources in total. 12 were static reviews, so publications. 5 were web-based resources. 14 of the 17 were publicly available, meaning you didn't have to go through any sort of membership process or fee to access it. 10 were focused on quantitative measures, and I believe the other 7 focused on both quantitative and qualitative. And 9 of them provided the actual measures so that you could, it's sort of like a one-stop shop. And then 6 included reliability and validity information. So, you know, that's something I've been emphasizing today, is the importance of accessing measures that might be reliable and valid. And so 6 of these resources give you that information. And so just some other tips to be thinking about as you go forward. If you're developing a new measure, then I would urge you to carefully define the construct. It's very common that step is skipped, and I think it's a good exercise and important for establishing psychometric quality. Focus measure development efforts on underdeveloped constructs. So the outer setting has received less attention despite its purported relevance, and so that might be a space to put your efforts. Work to establish psychometrics of underdeveloped measures. So as I said, some measures might not have publications demonstrating high psychometric strength, but you could contribute to that if the measure looks worth pursuing. Protocol papers from the journal Implementation Science and others could be helpful for accessing commonly used measures. I have in parentheses not to trust your peers at the same time, just as a checkpoint that, for example, in an organizational readiness review, a colleague of mine has currently in press, the most commonly used measure has actually the poorest psychometric properties, so just something to stay on the lookout for. Clarify the constructs for which self-reports are most appropriate, and use objective measures wherever possible. Engage your stakeholders in the use of measurements, in developing measures, in vetting them, and that's all I have for you today. So I wanted to acknowledge my funders and collaborators and sponsors. Thank you.